want to go ahead and start with a couple of polls so we get a sense of who's in the room and who's still with us. We've had some drop-off in participation. We were up to 90, now we're up at about 70 people. So the first poll question here, everybody's welcome, but this conference is designed for NIDLR grantees. So are you a NIDLR grantee? We've got about 2/3. Well, it's changing. Moving to half and half. I think that's getting pretty stable. Okay, so half grantees. Oh, look at that. Neck and neck. 49, 45. Okay, I mean, things may change slightly, but we can go ahead and just call it about half and half. And then for those half who are the NIDLR grantees, Lauren, if you could put up the next poll question. If you are a NIDLR grantee, please indicate the primary priority area of your work. And I know you may have more than one project. So really across the board here, knowledge translation, understandably, in the lead. I feel kind of like a sportscaster here. Oh, and a lot of employment outcome representation. Okay, so people who are going to be answering, oh, here's some health and function, which makes sense given some of the emphasis of what Becky and Mark were talking about. Okay, so we've got roughly 1/3 employment outcomes, 1/3 health and function, and 1/3 knowledge translation with some representation from everybody else. So that gives a little bit of a sense to the people who are going to be on the line, who you're talking to. So we can go ahead and put that down, Lauren. Thanks. So now I'm going to turn it over to Dr. Patricia Hein from the University of Colorado's Anschutz Medical Campus. She's going to lead the discussion of the first presentation, Engaging Stakeholders in Rehabilitation Research, Literature versus Reality, and help us see how it applies to the lives of NIDLR grantees. Patricia?
Okay, can you hear me?
Pretty much. Maybe if you could pull a little bit closer. We tried to test as many phone lines as we could during the break, but I'm not sure we got to you. So try again.
Okay, can you hear me? Hello?
Yes, but the loud, please speak as loudly as you're comfortable speaking and get as close as you can, or use your handset if you're on speakerphone. Let's do it one more time. Can you do 1, 2, 3, 4, 5?
Okay, so here is Patricia Hein, and I'm ready to start this exciting discussion.
Okay, great. We're interested to hear what you have to say, Patricia.
Okay, so my discussion is going to bring some focus to our first presentation, which was where we were talking about engaging stakeholders in rehabilitation research, the literature versus reality. So through the discussion, I just have a question. Can I ask, bring some topics and ask the participants to contribute to the talk?
Absolutely.
Okay. So based on this first presentation, what do you think about what is necessary to bring the reality about this knowledge translation?
Does anyone want to speak to that? Patricia, maybe if you repeated the question one more time while people are thinking through.
Okay. So there has been several challenges that were noted and several recommendations. And after the presentation, what you feel that based on your experience, based on your research on the population you serve, that will be a successful outcome, will be procedures that will turn the reality that's going to transfer that literature, the science to practice, to the real world application.
Keiko, did you have something to say while some of the participants might be thinking about that?
Well, I guess I'll let participants. I was just wondering if that's for us to comment on, but that's an interesting point on making concrete solutions. I guess one of the options is to have stakeholders engaged from the beginning of the research. That's something that we've learned, like in the examples we gave, that it was crucial in making this reality, is not having them only at the end or at the dissemination and implementation phase, but sitting at the table and determining the research questions with them. So that was one practical solution, but I guess I'll let participants suggest others.
And can I add a comment to that response? What are the strategies that we should consider to keep them engaged in the process, not to lose them? Because many times those stakeholders, they are themselves already stressed or with multiple obligations, requirements because of their condition. So how we can facilitate the process to keep them engaged and contributing through the entire process?
Yeah, well, one of the strategies that we've seen that have worked, not saying it's the only solution, but is to have a clear stakeholder engagement process established from the beginning. So let's say an agreement of what exactly you expect, what people expect from you, what you expect from people. So let's say we'll have a monthly teleconference and we expect you to be on it if you want to continue to be part of this group. And on the other hand, checking at each point, okay, once you participate in a teleconference, what's good for you, or what has contributed to that, or what has been productive or interesting or useful for you from this meeting. Having face-to-face meetings at regular points. Teleconferences are great, and this meeting is a good example, but it is really hard to sustain, I find, engagement in the long run only with teleconferences. So it's really important that you try to meet your stakeholders and have face-to-face meetings in a time that is convenient for them, and providing constant updates, so being responsive to what's happening, because sometimes a lot is happening in the research background. So you were collecting data, or you were developing a questionnaire, or you were doing interviews. Whatever you're doing, it's important to keep people informed so that they don't feel excluded, and then all of a sudden something happens and you need them again, and then you ask them again. So I think having clear engagement rules and being responsive are two ways to sustain the engagement.
Definitely, we're getting some great contributions here in the chat where the theme is similar to what's going on here on the phone line, the importance of maintaining relationships and keeping stakeholders involved in various ways from the get-go, from the creation of dissemination materials and methods, keeping them updated. So nice consensus developing here. Patricia, did you have some other comments?
Yes, and another comment is about those definitions that we use sometimes to define very simplistic concepts. So when you talk to your stakeholders, when you include engage the population and now the groups needed, do you usually use the definition knowledge translation, or you simplify as just information, education? What do you feel about some of those definitions that we have a tendency to bring more complexity, being more technical, and then how those turn to be obstacles in the way that we want to facilitate, in the way that we want to make things simple for the public to understand what we do and participate.
In response to that, this is Jim Lee. We have found that when we're dealing with stakeholders, we have to translate it into their verbiage, their how they're going to assimilate the knowledge, what their language is. So and just Chaikin's comment, how early in the research process should you bring in stakeholders? As early as possible. Consumers should be involved from the very get-go. And a lot of our research and development projects that we do as NIDOR grantees. Same with a company. If we're going to actually develop a product going forward, we should bring them in as soon as possible. But again, we're translating the research findings and using terminologies, not necessarily a term such as knowledge translation. We're using other terminologies that is more convenient for them, they're used to, and they understand.
Yeah, I agree with that, and knowledge translation. There was one paper just showing how many different terms there exist just for knowledge translation, and there are many. So I guess it's important not to stick to any specific term, but rather to clarify whatever you're using, name it, right? If it's a training, if it's education, if it's dissemination, if it's implementation, just explain in plain language what do you mean by it, right? And we're talking about here research findings, even the definition of what's research can be, that's something I learned recently, like for, decision makers, research, there is academic research, which is what we researchers call research, and there's research been done in population data or from other sources, which is also research. So as long as you are clarifying what the terms are with your group so that everybody knows and understands what you're talking about, then I don't think it's important to stick to a specific term, but how to clarify what you mean by it.
Okay.
Great. Thanks, Patricia. So this is reminding me of John Chida, the NIDOR director's comment talking about our agency as multicultural, because we are talking about translating, and it's not just a dialogue between researchers and one global audience of stakeholders, but that, as many people of the presenters have brought up, it would need to be done differently for different audiences. So it seems a timely time to bring up, Lauren, our next poll question, where we get a sense of, for our participants, what kind of stakeholders they are tending to engage.
Okay.
Lauren, can you pull up the poll? So for all of our participants, give us a sense of who is most involved in your research. Okay, great. These polls, they kind of remind me of microwave popcorn. You kind of wait and there's a big explosion and there's a few more little kernels coming up here. But so we're getting a consensus that people with disabilities and their family members and allies are above, far and away, most involved in outreach. But about half of you also engage service providers and clinicians and other researchers. This is interesting because we, at the KTDRR, we do an annual survey of NIDOR grantees, and we force them just to pick one audience, and it usually comes out that other researchers are their primary, usually the other audience that's most involved in their research, how important those other audiences are if we did allow a multiple choice here. And looking through the participant chat here, the wireless and consumer electronics industry is an audience for some. The for that other there, one of the others. Okay, so given that comment about industry, we would like to turn now to the Jeff Chakin's comments. She is the Media and Public Education Manager at the National Rehabilitation Information Center, which we usually refer to as NARIC. She's going to lead us in reflecting on Jim Leahy's presentation, Translating Research Findings for Uptake and Use by Various Stakeholders. Jeff, you ready?
Thanks, yes, thanks, Kathleen. I really liked, Jim, I really liked your presentation. It got me thinking about a lot of good concepts. And what struck me was the idea of identifying the brokers, the people who are really the bridges, who are the ones who are going to be transmitting what you've created to the people that are going to use it, whether they are, as you said, nurses, assistive technology professionals, independent living advocates. And it sort of got me thinking on how exactly do we identify those brokers when we are creating our own outreach materials. If you feel free to comment on that while I'm kind of going through my notes from your presentation.
Sure. Basically, if we're based at a university or something like that, you will deal, some of the brokers that you will deal with will be primarily your technology transfer offices, because they're going to be actually taking the knowledge that you've developed and trying to translate it for use by a knowledge user, a manufacturer, licensing it. So they're easily identified and worked with because, again, they're a part of your university. If you're not part of a university, you're having to do a lot of that work on your own. And there are resources out there that are available for researchers that aren't affiliated with the university that, we have some things on our website that you can go through and look at also.
Yeah, and actually I was going through the website, and if the other participants have not had an opportunity to look through the examples of how specific messages were crafted for different audiences on the KT4TT website, I highly recommend it, and just comparing them side by side. And what really struck me is, as a core message, is you really have to understand your stakeholders' language and their learning method, their learning milieu, and get into it and write from that perspective. It's really fascinating to put these things up side by side and see when a direct message works best and when more of a health improvement message works best. This is an issue you may experience. These are the findings. This is what you can do to improve it. And I really love the idea of distilling everything down to that elevator pitch. It really brings it down to what's your most important message, and then kind of building up from there.
Right, and I agree with the comment you made regarding getting the language to them. Using their language, how they're going to understand what the research findings are and how they're going to benefit them. It's paramount importance, and we try to do that with consumers, research, et cetera, and we're tailoring any of our communication packages, our CKPs, to those specific stakeholder groups, and again, how they want to accept new knowledge.
Let's see what other notes I had. One of the things you talked about was that the technology transfer costs more than the innovation itself, Greg Vanderheiden's comments.
Sure.
What do you think the ratio is of innovation versus technology transfer, the cost in either time or money or both?
Well, it depends on the grantee. We always talk about, like even in Greg's case, he will start with his end in mind. He will do his scoping reviews. He's going to build in his new product best practices at the beginning. He's going to make sure that he's got consumers involved in that new product development early on. And he's going to try to enlist a corporate partner, as we all do, as early on. So it depends on the project, because once you come to completion on that project and finish it, then you're getting into time outside your grant that you're going to have to spend with a manufacturer, with your technology transfer office, supporting the transfer of your findings to someone else. And you have to operate really on those people's timelines, not your academic timelines that you might be if you're affiliated with a university, for example. So if you're dealing with a technology transfer office at a university who's dealing with a manufacturer, you have to respond relatively quickly to their needs to make sure that what you have developed gets out there and gets transferred. Costs, again, depends on the grantee. It could be, 2/3 of what you spent on your research and development project could be technology transfer, and that's support after, the transfer or during the transfer. You have to be available to answer questions, whether it be from a technical standpoint, whether it be from a marketing standpoint, whether it be for a consumer standpoint, why you did what you did. Okay.
Excellent. Thanks. One other thing that I was thinking about while listening to your presentation was the idea of personas. The wireless RERC previously developed these personas that the wireless industry can use to kind of hang on concepts and how that facilitates some of the tech transfer. I would encourage anybody to look at persona research as you're thinking about your stakeholders. And it's kind of the opposite end of the stakeholder. These stakeholders are real people, and the personas are all those real people made into a descriptive form for industry, for developers.
Sure.
Let's see. There's some questions come up, like what methods are effective to evaluate the success or positive effects of the KT used? I think that's sort of a general question.
Well, it depends. What we've done in the past, well, of course, any transfers, if you're getting your, if you're doing any types of surveys after the fact on if it's just research findings on their uptake and use, if it's products being transferred, you can actually do efficacy studies on products that you have transferred and brought to the marketplace. Again, that one might be on your next grant cycle, and you write that in as a project on your next grant cycle. But you can actually do an efficacy study to see if what you've brought to the market is actually benefiting people with disabilities more so than what they had or were using in the past. And going back to our website, we have a guide for efficacy studies that is also on our website that grantees could follow.
Cool. I think that one last thought that I had just listening to all the presentations is you really have to plan and budget for knowledge translation. And I think we already know what happens when you don't plan and budget for it, either anecdotally or just knowing how much amazing research is out there, but it's not in use yet. So that's definitely a takeaway for me in general.
Right. One other takeaway I'd like everybody to have is to make sure they do, and I'll call it scoping reviews early on in their development process, or whether it's for research development for their projects. In other words, trying to find out what others are doing, what's been done in the field, what consumers really want and need, involving the consumers early on. I've seen some grantees who will develop a product that they think is great, but really they're just reinventing the wheel and someone else has done it already. But they like to have their own hand in it and develop it in their own method in, presenting something. And that is not always the most cost efficient, because if something is out there already, it can just be tweaked for an additional, other clients.
Definitely. Excellent. Well, thanks very much, Jim.
Okay.
Okay, thanks, Jess and Jim. That was really a stimulating exchange. So thinking through about stakeholders, there are various ways that they can be engaged in research. So we wanted to pull up the fourth poll question. And this maps in some ways on what Chantal and Keiko were talking about, their various ways. So for the participants, in what ways have you been able to engage stakeholders? And it may be that you can point out in the chat that various types of audiences you found easier to engage in particular ways, and others not so much, whether or not the pros and cons of that limitation, if you've experienced that. So we're finding
Who was that question addressed to?
the participants.
Just to the group?
They're doing a poll right now, Jim.
Okay, sorry.
Mm-hmm. So it's kind of stabilizing, and it's seeming that most commonly people participating have been able to engage stakeholders in collecting or providing data, about 3/4 of them, 70%, and around that number or proportion have been able to engage stakeholders in setting goals and identifying problems. 40% have been able to work with stakeholders in analyzing or interpreting data, but only 1 in 4, 25.9%, in selecting methods. So it kind of relates to what Patricia Hines' point previously about theoretical terms like knowledge translation or methods that might require more expertise, that there is that tension. And one of the presenters earlier had mentioned, the pros and cons, or it may be necessary to train people before you engage them in certain kinds of activities. So let's go ahead and have some reaction to our third presentation for the day. Leading thoughts about that is Eva Larari, the Assistant Director of the Northwest ADA Center, and Hannah Rudstum, who's a Senior Extension Associate at Cornell University and the Director of Training for the Northeast ADA Center. The ADA centers are engaged in many activities, as you've heard, so I think that both Hannah and Eva are going to have quite a lot to contribute to the third presentation, which, if you remember, was Practical KT, Ensuring Relevance and Use. So Eva and Hannah, I wasn't sure which one of you wanted to go first, or you're just going to see how it goes?
Well, this is Hannah. Why don't I start? And Eva, if you want to jump in, go right ahead if that sounds good to you. I think that I've heard, we've heard loud and clear from everyone the importance of involving the stakeholders, and we certainly saw that in real life in this presentation. And it's been a wonderful experience for me to be a part of that. And I think that during the last polling question, everyone, a lot of you talked about the importance of involving stakeholders in setting the goal, which is, of course, really, really important. I think what we've kind of looked at in this presentation, and also, as I said, being involved in the process itself, is also involving the stakeholders in setting the research question itself. Mark did such a wonderful job of talking about sort of the history of evidence-based knowledge and what that means. And I think we also, as we went down in the presentation, really realized that it doesn't matter how good the evidence is if it's not the right question. So I think we saw in this presentation a really good look at how the deep texture of end users' voices have been integrated into the development of the product. We've also seen that this isn't easy. This is often a messy process. It's not as neat and clean as the models suggest. It's been a pleasure for me to be involved in this as I've gone along. We have a number of you had questions about impact measurement, and I think, Eva, you were going to probably focus on this as well, but I have heard from end users in our region who have used the fact sheets, and what we're finding is that they're often not just using them for themselves. They're using them in some sort of role of advocacy. We've had people tell us that they are using the fact sheets to educate their employers about the ADA. We've also had veterans telling us that they're using the fact sheet to educate sometimes the veteran counselors that they're working with. So that's very important to get this sense of universal design, not just in terms of accessibility, but also in terms of the multiple audiences that have to be balanced when you're making these fact sheets. I think the other points that you made were also right on target. Again, the messiness and complexity of creating a very practical approach that involves the end user's voices. What does plain language mean for different end users? So I was going to maybe ask the authors to talk a little bit more, since there were quite a few questions, about measuring these. Seen similar stories to what I've seen on how the knowledge products are being used, not just for their own knowledge, but also for advocacy.
This is Mark, and Becky actually had to leave because it's after 10 p.m. in South Africa, and she was going to get kicked out of her internet cafe. So it's just me.
Okay.
I'll try to translate for Becky. But you know, the issue of measuring outcomes related to the use of products is obviously a challenging one, and we to some extent, I wouldn't say rely, but we get a lot of information anecdotally from people about how they're using it, what they're using it to do. And I think, Hannah, actually probably the regional centers are much more closely tied into the consumer to get that kind of consumer level information. At the National Center, we have implemented some approaches. I wouldn't say they're perfect, but they're a good start. And for those of you who are at NIDLR, the terms will work, but that we have a process for collecting information about outputs, and we have a process for collecting information about outcomes. So we have an outcome measurement system, which is a database that we use to collect information about technical assistance that's being provided, training that's being provided, and public awareness activities. And in all of those areas, there's a place to record what materials are disseminated. So we, within the context of the work of the National Network, we capture material dissemination to consumers. We also capture those outputs within the context of the national website, which is the informational, one of the informational resources of the National Network, and it's the one where all the national materials are located. So we certainly track the analytics of the website as well. But then we have thought about, well, what does it mean to look at outcomes from a KT project? And you know, the way we've moved, and I think it's not the only way, but it's also kind of a pragmatic way, is to begin by looking at, not to look at outcomes of a specific product or set of products, but to look at outcomes related to the work of the National Network. And one of the primary tasks of the National Network is technical assistance. So we conduct an outcomes survey, a follow-up survey on a subset of the technical assistance interactions that are conducted across the 10 regions. And we shoot for, and we do this quarterly, we shoot for 25 respondents, 25 surveys from each of the 10 regional centers. And people in the centers literally call people back and say, hey, we talked to you 3 months ago, and this was the topic, and we sent you this fact sheet. Did anything happen? And we record that information, and then the KT Center codes it to determine what kind of an ADA implementation it was. You know, was it an implementation? Was it a decision? Was it simply somebody learned more and gained knowledge? And then we provide that information back to the National Network. I think that's an interesting thing to think about because to some extent, I think we're less interested in, did this specific fact sheet, was it implemented and did it have an outcome? But really, how are these informational materials being used within the context of projects, within the context of clinics and hospitals? We're interested in the interaction, I think, and it's complex, but the interaction between materials on the one hand, evidence-based materials, and the people who use those evidence-based materials. And I think we're still certainly in the process of figuring out how to capture that. But that's kind of where we're at right now. Does that answer
Great.
the question?
Thank you. Eva, did you have anything you would like to add?
Yeah, so I wanted to comment on what Becky talked about, how practical KT perspective and the consumer expert are looking forward, because part of my job on a daily basis is really to interact with customers, consumer groups who contact us and actually are surprised that they're getting a live person and that we're happy to talk to them about, figuring out really what their question is about. So one thing is to provide them the information. The other thing, too, is to really get to what are they information are they looking for? Is it really that they related to what they want in the beginning? So oftentimes their initial question leads to the actual information that they want, and that's when we can provide them the resources. As an example, a fact sheet that is readable, understandable, and we can walk them through it in terms of how they can use it, what would be the benefit of that. So people are oftentimes they would call us because they're desperately needing, someone to talk to, someone who would listen and understand their frustration. So really the value of having a TA and providing them that information, not only in writing but also someone that they can talk to, is that it's consistent, it's reliable. You provide the information, more of a really not an advocate but in a neutral way, but also it's confidential and that really sticks out to them. So I just wanted to make note of that.
And I think that relates back to the last point that you were making, Mark, is we also get through this outreach, this direct outreach, we do get a very good sense of the context within which knowledge is being used. So not just the initial question, as you said, Eva, but what is the context that people, what is the real question they want answered? And, again, coming back to the very important point of knowledge translation is not just how you package the knowledge or how you make the website, but what are the questions that people have and why do they have them? What are they trying to change in their own lives or in the lives of others? So I think that, as we saw in this great presentation, Mark and Becky did a wonderful job. What we saw is that this is a complex process. This is not easy to do. We do have survey research and we have other types of research, but sometimes just having your finger on the pulse of what stakeholders are thinking, as you just described, Eva, is really, really key, really important. So, Mark, I don't know.
Oh, I think I just wanted to respond. I think that, sorry, just quickly, Eva. I think that's a really good point, and I think it's unique in some ways about the national network, and that is that the network has a primary function of technical assistance, and each of the regional centers have technical assistance specialists, and those TA specialists are the front line, and they are the filters through which complex information comes and is translated out for consumers who, as Becky noted, cross the range in terms of their understanding about the ADA and the law. And so I think that it's interesting to think about knowledge translation coming from a KT platform with support of this broad network of individuals who are actually right on the front line of providing technical assistance and day-to-day information for people. So I think that that's a benefit the network has that maybe some research projects don't have. They don't have that built-in face-to-face connection with the people who have the questions.
Absolutely.
Eva, did you have?
Yeah.
Yeah, and I wanted to add to that, when we get a call, it's really difficult for someone to find useful information online. There's so many information, but everyone has their own specific issue or specific topic that, the TA, the technical assistance person, will be the one kind of sorting it out and figuring out, okay, this is the information that might be useful for you. So
the way, knowledge translate, it's sort of like you're kind of, figuring it out for the consumer and, providing that guidance on how to use that information.
Mm-hmm. Mm-hmm. Great. Does anybody have any more comments or?
I just wanted to point out, this is Kathleen, there's a nice parallel going on in the interactive discussion chat where people are, well, Agnostic has said, sometimes I get tired of being nice. When the time is right, we need to look people straight in the eye and give them the reality about disability, discrimination, that's in nursing home statistics, barriers to healthcare disparities faced by women with disabilities, et cetera. And it just underscores what y'all have been talking about on the phone, the value of the frontline TA providers' knowledge and experience about real hardcore issues that prompt people to call in to the ABA centers. So we are aware at KTDRR that Night Alert funds not only research, but also development and programs. So Lauren, we wanted to move into the last poll question where we asked people how they've engaged stakeholders in developing these services and programs and products. So wow, people jumped right on that. So obviously these things can be iterative, but there is somewhat of a linear sense of the questions that from the get-go you would perhaps want help with designing a product or a program, and then there's the process of producing it and then getting feedback. Although I think it was Jim Leahy who pointed out that sometimes the cycle can begin again in the next award where you go back to refine a product or service or program. So it seems that people very often do get that input into the design of it, and then next, most often they get feedback, but it's in that process of producing the product or program where it's maybe a little more difficult or less common, that stakeholders are less commonly engaged, which maps onto the research trajectory or of the data that we saw in the previous poll question, where people were getting more comments, getting more engagement from designing research questions and selecting the methods. Does everyone, we haven't gotten to every single question in the chat. There has been a lot of discussion about evaluating the impact, and that was really helpful tool. I don't know if people noticed in the interactive discussion chat what Chantal posted. There's apparently a resource online where there are some tools to evaluate stakeholder engagement. And I know the outcomes management system that Mark was talking about took a really long time to develop and get everyone on board using it. So clearly it's important, and it's a very involved process, so it's great to have these discussions so we can get ideas about how to start doing that ourselves more than maybe is done. Is there anything else anybody wanted to add? We're kind of getting near the end. I have a few housekeeping comments I'm going to have to make before we close, but if there's anything else, someone just had, a brilliant insight and want to make sure to share it. There's a lot of stuff going on in the chat. Can we talk a little bit about reaching clinicians? I'm really bothered by the disconnect. Yeah, so this was a question that came up, Keiko, during your presentation. You had, we can't pull it up right now, but on slide 18, there was the graphic that I think you got from CIHR, where there was the hidden valley, the valleys. You know what I'm talking about? Where,
yeah, the from basic research to health decision making in clinical practice. That was the one?
Right. So it's problematic how long that process takes, and so the participant is wondering, gee, isn't there a way to catalyze that clinical impact instead of having that middle step where someone takes the kind of hard biomedical research and.
Well, I guess that's part of what we are all trying to do here, right? I mean, just creating research that is meaningful from the get-go, and having the stakeholders in place from the beginning. I guess that's part of what we're doing to address these valleys, right, and to decrease this distance that you're not even just in your closed ivory tower idea or lab, that whatever is happening here, it doesn't have any relevance to any stakeholders or to anyone, any knowledge users, including clinicians. So I think by doing this already, it's a step in decreasing those valleys or in passing faster through the valleys, I guess. Not to say that there is, of course, an important role of basic research, biomedical research that has to be done, and that's how scientific discoveries at that level have to occur, and that's much slower application into clinical practice. But I guess this is all, the integrated KT idea is always trying to address that. There is clearly a disconnect that we try to decrease by having people engaged and having people saying what's the relevance of the research questions that we're asking from the beginning, so it doesn't get that long. But it is for sure a process, and someone else has put before that it's a complex process, and I agree. I guess we're all starting, but having these discussions and making this as an important part of research, and something that we budget for, I said before, like that we ask funds to engage these people in the beginning, to be sitting around the table from the beginning of the research proposal. I guess it's one tentative way to decrease these values and to make this research to practice continue and move faster.
And yeah, I think it also really is an opportunity for us to thank NIDLR for the amount of funding that they do give to funding a bunch of KT centers that can serve as brokers in between researchers, and not only necessarily directly to clinicians, but as you pointed out in your presentation, Keiko, the clinicians are learning in workshops, and sometimes what the KT broker is doing is helping to infuse those workshops with evidence coming from that first peak in your cycle there.
Yeah, exactly. If we find the means or the mediums that are most easier reach clinicians by doing that, like, transforming our research articles into information that goes to the professional associations, that goes into seminars and workshops, and having these conversations, I think it's a way of doing it. For sure, having a funding source that addresses that need or that type of research is crucial.
Right. So tying it into Mark and Becky's presentation too, in the concept of the KT centers as KT platforms, was really giving me food for thought, since, as you know, we have a couple of them. Okay, so I think we are going to wrap things up. Thank you so much to Eva and Hannah for really thoughtful comments and discussions. And to everyone on the line, we hope today's sessions have been useful to you and that you can really take it and apply it to your NIDLR grants. I want to give a big thank you to John Cheetah, Pinjai Sudsawat, and Dwayne Norris, who helped us kick off the conference. Representatives today, Keiko, Jim, and Mark, for being able to stay through today's discussion, and to Patricia, Jeff, Eva, and Hannah for their thoughts